Friends, I am Dr. Surjit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 15 homeopathic remedies for heart diseases. Though I will be describing the remedies, the symptoms of the remedies where in heart disease homeopathic medicine can be used, yet a preliminary discussion about the disease is very important. Otherwise, we cannot follow the symptoms. So, to start with, just introduction. What are the common diseases of heart? Number one, coronary, artery and vascular diseases. For example, angina, there is angina pectoris and heart attack. Heart rhythm disorder. For example, cardiac arrest. Number three, heart failure due to heart attack and high blood pressure. Number four, pericarditis. There are so many heart diseases. I have chosen just common things. Just common thing: angina, heart attack, cardiac arrest, heart failure, pericarditis. In the picture, there may be some name which are not included here. Again, some name here I have included here, but the picture may not be there. Doesn't matter. But I will describe only these things. What is written in this 1, 2, 3, 4 points. Please remember this. Then I will take up the medicines. What are coronary, artery and vascular diseases? Within the lumen of coronary arteries, cholesterol, calcium, fibrin, waste products, WBCs, etc. mix up to form a viscid solid called plaque, which narrows or blocks the lumen, causing reduced or no blood supply to cardiac muscles, which go into a state of infarction, producing different heart diseases called CAVD or ischemic heart diseases also. These are the commonest of all heart diseases. Angina pectoris, in short angina, heart attack leading to heart failure and death. These are the commonest examples. Plaque formation has been shown within the lumen here. This is the formation of plaque. Plaque formation within the lumen. This is in internal photograph of this fine structures. This is a fine structure. What happening in there? It is shown here. What are signs, symptoms of coronary, artery and vascular disease, angina, heart attacks? Common symptoms: squeezing pain in chest and severe uneasiness, deep weakness, nausea, cold sweat on face and chest, pain in hands, shoulders and jaw, dyspnea, loss of consciousness. Women feel sleep disturbance, pain between wing bones of back, vertigo before attack. That is, women get some precautionary symptom prior to actual heart attack. Generally, men do not feel it. This disease, especially heart attack, demands immediate attention. Delay may cause death. If you see such a patient, arrange to send the affected person to nearby cardiologist, nursing home, hospital immediately. This is an emergency situation. What are causes of cardiac arrest? Acute myocarditis, congenital heart diseases, cardiomyopathy, valvular heart diseases, coronary artery diseases, etc. How cardiac arrest is treated? This demands instant physical intervention by CPR. CPR is cardiopulmonary resuscitation, when both breathing and pulse are imperceptible. Suddenly, this is seen in cardiac patient where this cardiac arrest is there, that his pulse and breathing both had stopped. Now, what is CPR? It is a combination, mind it. It is a combination of rescue breathing and chest compression to provide oxygen to lungs and to keep oxygenated blood circulating until heart beats, breathing is restored. Every citizen of the world, mind it, every citizen of the world should know this to save a life. 30 chest pushes, 2 pushes per second, followed by 2 rescue breathing, each for 1 second, is called a cycle of CPR. This is continued till doctor takes up the situation or casualty restores to normal breathing and pulse. Here, chest pushing and rescue breathing both are displayed in separate images. This is a very important thing. Actually, this is not medical treatment. This is actually type of first aid, but it is life-saving. It is more important than medicine. No medicine will be acting here. No medicine will act here. Useless. In case of cardiac arrest, medicine is almost useless. Immediate CPR is the necessary thing. What is pericarditis? All know that double layer covering over heart is called pericardium. Inflammation of this covering is called pericarditis. Note the picture on the right hand side. This is the double layer of covering. It is called pericardium. And in this picture, you see within the pericardial layers there is accumulation of fluid. This is pericarditis. This is pericarditis, and this is normal pericardium. General causes are microbial infection, bacteria, fungus, virus, parasite, etc. Injury, autoimmune disease like lupus, rheumatoid arthritis, scleroderma, and even idiopathic. What are idiopathic means when there is no region. What are signs and symptoms of pericarditis? Piercing pain in chest, back in between two shoulders, better when sitting, head leaning forward, worse during cough, deep inhalation, lying on back, chewing, dry cough, weariness, anxiety, feet, ankle, legs swollen. These are common symptoms of pericarditis. Abrotinum for heart diseases. Metastasis from gout or rheumatism to heart, feeble pulse, sinking feeling as if dying, dyspnea, profuse sweat, endocarditis with penetrating pain across chest. That is, this medicine is useful for metastasis from heart metastasis, that is heart disease due to metastasis from gout or rheumatism, and also it is good for endocarditis. Ginkgo made for heart diseases, swelling, great tenderness of cardiac region with severe palpitation and tearing pain, irregular spasmodic action of the heart, occasional one violent thump. That is, here some irregularity of the pulse is there. Pulse irregular, small, weak, scarcely perceptible. That is a different picture here compared to abrotinum. Tabicum for heart diseases, cardiomegaly, the heart is enlarged, palpitation when lying down on the left side, paroxysm suffocation with tightness across upper part of chest, pain shoots from heart down to left arm and up to neck, common symptoms of cardiac attack. Pain shoots from the heart down to left arm, jaw, neck, shoulder, etc. Common symptoms. Musky volatility. Musky volatility, actually this means black spot in front of eyes. Tinnitus aurium, some peculiar sound is audible in the ear. It is called tinnitus aurium. This sound produced within the ear, not external sound. Extremity is cold, clammy, pulse intermittent, but mind is clear, no fear, anxiety. That is in case of tabicum, you keep tabicum there where there is no fear, anxiety of mind in the particular person affected. Silesia for heart diseases. Heart troubles from nervous exhaustion, violent hammering, palpitation after quick motion, palpitation while sitting so hard as he had to hold on to something, but worse from standing, which causes anxiety. Violent palpitation in the evening, restless, fidgety, starts little noise. A complete specific picture of the person. Phytolacca for heart diseases, chronic rheumatic endocarditis, clear-cut symptom, endocarditis, shock of pain in cardiac region, shooting into right arm. I have given a star here because generally pain shoots in the left arm, here in the right arm. This is it. uncommon peculiar symptom. Mind it, when there is some symptom which is uncommon peculiar, you can select a medicine depending on a particular symptom. If somebody reports you that his pain is in the right arm, you can at once give Phytolacca, because this single symptom will individualize the case, because this is uncommon, strange and peculiar symptom. Awakens with lameness near heart, worse while expiration, cannot get to sleep again. Again another thing, you see this thing also, the here written here, worse while expiration. Generally, patient feels pain or he feels worse while inspiration, but here it is expiration. This is also an uncommon symptom. Spigelia for heart diseases, rheumatic pericarditis, great anxiety about heart, purring sensation over cardiac region, systolic blowing at the apex. This can be heard with the help of stethoscope auscultation, with tearing constriction above pit of the stomach. Pit of the stomach, this depression just beneath the sternum bone. That is called pit of the stomach. Oppression worse by sitting down or leaning forward. Great dyspnea at every change of position. Mind this, at every change of position there is dyspnea. Audible beating of heart causing a pain that is felt through back. Arthritic pain and stiffness of joint. Very nice picture. Rheumatics for heart diseases. Heart feels as if suddenly stopped beating, followed by a heavy throbbing through chest. Here, the double up is there in the rhythm of heart. There is pulse, throbbing through chest, aching in heart with throbbing of carotids. Dyspnea worse while lying, has to sit up, burning in pericardium, prostration, violent dry cough provoked by tickling in throat pit. Throat pit means just above the sternum bone there is also a depression, that is throat pit, and just beneath the sternum there is a pit that is called that pit of the stomach. It is throat pit. Phosphorus for heart diseases, endocarditis or myocarditis, both muscle and inner lining of the heart, both type of inflammatory changes. During acute inflammatory rheumatism or during pneumonia. See this, endocarditis, myocarditis during acute inflammatory rheumatism or during pneumonia. Advanced stage of secondary dilatation of the heart, fatty degeneration and destruction of heart muscle fibers of the heart. Nervous palpitation from emotions or excitation, especially of old maid, as from facing an unexpected guest. It's a very peculiar symptom. Facing an unexpected guest, the maid is excited. There is nervous palpitation in him, in her actually. This is peculiar symptoms. Anyway, this has been noted by the provers who has proved these medicines, phosphorus. Phosphorus is very great medicine here. We can see that it's endocarditis, myocarditis, both have been affected. Dilatation of the heart is there. Fatty degeneration of muscle fiber is also there, and nervous palpitation. There is functional. This is functional stages. The maid is facing excitation. As he faces an unexpected guest, he becomes excited, nervous. This is purely functional symptom. And here, if endocarditis, myocarditis, acute inflammatory rheumatism, advanced stage of secondary dilatation, these are all organic symptoms. The heart is affected as an organ. Here it is functional. Platinum made for heart diseases. Initial stage of pericarditis, endocarditis. Initial stage due to articular rheumatism with intense anxiety, great palpitation in atherosclerotic women suffering from too early or copious menses, but for a short time with dark clotted blood. That is here with the heart diseases, some other disease has been related. It is related. This is called concomitant symptoms. The person feeling heart disease has got some trouble in during menstruation also. That has been included and related here. These are important points because Concomitant means adjoining trouble with the main trouble, that is concomitant. Palpitation after mental exertion accompanied by anxiety, weeping due to an exhausted nervous condition. Pulse regular but small and weak. See, in homeopathy there are the disease picture is so complex and so fine and so different, so wide. It is really astounding. If we go through critically every medicine, you will see that is a different picture from others. Nasal trip for heart disease. Endocarditis. Endocarditis means inflammation of endocardium. You know that the internal lining of the heart has got 4 chambers. This internal lining of the heart is called endocardium. Inflammation of that thing is called endocarditis. It's a very severe disease. It's a very severe type of disease. So endocarditis is covered by nasal trip. Gasping for breath with tiredness, difficult swallowing, dry, hard cough, cold clammy skin, palpitation and pain down the spine. Valvular diseases. Mind it, all the valves, there are 4 valves in heart, all the valves are covered with endocardium. So when endocardium is in trouble, the valve also in difficulty. So valvular disease is also covered by nasal trip. Heart acting thunderously with frontotemporal headache, great depression of spirit, aversion to talking, acute stitching pain and sense of oppression in the chest as if a hot iron rod had run into it or a huge weight put on it. This is a peculiar uncommon symptom, so take care. If this symptom is reported, you can safely give direct nasal trip. If some patient reports that his feeling is as if hot something iron or something metallic rod is running to his heart, this symptom or a huge weight is put on the heart, feelings, so then nasal trip is the medicine. Cannot lie on left side a moment but feels very much better while on right side. Worse at night, compelling to sit at open window, limbs swollen hugely. Sorry. Lachesis for heart disease. After slight movement, throbbing of heart perceptible to the hand and ear. Rheumatismus cordis. This is a technical name of this particular trouble. Oppressive pain in chest with feeling of expansion of heart. Felt better by lactation. Deep sighing every few minutes. Fits of suffocation and fainting from movement. Pulse weak, intermittent. Stitches in left side. Diseases very much worse during sleep. So subject do not want to sleep can lie on the right side only. Mind this, lachesis, patient of lachesis, his or her all troubles is worse during sleep, and so the patient generally do not want to sleep because he knows that if I sleep then I will be in trouble. Hydropericardium or hydrothorax. Mind it, hydropericardium means, you know the pericardium. Pericardium is the external serous layer of the heart. Within that 2 serous layer, sometimes water is accumulated. That is called hydroperitoneum. And hydrothorax means lung. You know, the serous covering of the lung is called pleura. When water is accumulated within that pleura, it is called hydrothorax. From organic lesion of heart, hydrothorax. Lesion up in the heart, but hydrothorax has come about, and hydropericardium is already defined. So all this is covered by lachesis. Lithium carb for heart disease. Hypertrophy from valvular deficiency, especially aortic failure in persons of gouty and rheumatic diathesis. Mental excitation causing fluttering of heart, worse by bending forward, shocks and jerks about the heart, better after urination, paralytic stiffness of whole body, finger joints tender, painful. You see this picture? This is normal heart. Now here the heart is hypertrophy. How much see this muscles has gone so much swollen. Hypertrophy heart. This is hypertrophy of the heart. Lycopodium for heart disease. Dilated heart. Palpitation every evening with great fullness in stomach and abdomen from flatulence, pulsating, tearing in cardiac region, pulse faster in late afternoon or after eating, gargling or wind in the upper abdomen under apex. Now, what is apex? See this picture. This is heart. This is heart. This is heart. Now, this portion is called apex, and this portion is called base. This is apex and base. So, this gargling or wind in upper abdomen under apex. So, just after apex or beneath the apex, there are intestines, and there is gargling sound. The same figure is here. It is in the rib cage. It is without the rib. Calicar for heart disease. Deposits on cardiac valves. This is the cardiac valve. See how calcium has been deposited. Late stage of endocarditis and pericarditis with sharp stitching pain about the heart and through to scapula. Palpitation in spales, taking away the breath, impending suffocation with inability to lie down. Systolic murmur. This systolic murmur is a sound, abnormal sound in the heart, can only be audible through stethoscope by experts. Insufficiency of mitral valve, pulse unequal, irregular, intermittent or weak or rapid, pulsation all over the body. Caliheart for heart disease. Pericardial effusion with grid dyspnea. This is pericardial effusion, picture of pericardial effusion. See, this is a pericardial space. This space is as thin as, you cannot see how thin it is, but here the pericardial space is elongated because fluid has accumulated within the space. And when fluid is accumulated, it is called, in the pericardial space, it is called pericardial effusion. It's a very grave disease with great dyspnea, weakness of cardiac muscles, extreme smothering sensation about the heart, awakening the patient from sleep and get out of bed. Graphitis, calibicrum, lapicis. All these medicines had got the same symptoms. Start sharp stitching pain through lung and heart. Worse from any motion. Valvular defects after repeated endocarditis. When there is endocarditis, there is internal layer of the heart, then valvular disease almost is a must because all the valves are covered with endocardium. Tumultuous, violent, intermittent, irregular action of heart with pain across the chest, especially affecting right ventricle, which gets dilated. This is image of in the this image. I mean this dilatation of the heart pericardium is seen through USG. Now, one final words. If you are an expert in heart disease treatment, then homeopathy is a boon to you. Mind you, if you know how to read or how to study heart diseases, then homeopathic medicine are of great values to you. But if you are an ordinary general physician, then you always try to send the patient to an expert for overall checkup, because you may give medicine, the medicine may ameliorate his situation, but the internal, if you cannot know the internal pathology, what happens within the patient's heart, then it will be very dangerous for the patient. He may be relieved of the symptoms, but the disease may aggravate. So whenever, if you are an ordinary physician and the patient has come, you can feel, you can understand that he is a patient of heart diseases. You have given medicine, the medicine is acted, yet your suggestion to him will be, please consult a cardiologist, expert cardiologist for checkup. Please do this. Or if you are really a cardiologist, if you are really a cardiologist, then homeopathic medicines, you will be just beyond joy when we get this name of the medicines and their symptom.
There are so many cardiologists all over the world who are treating cardiac diseases with the help of homeopathic medicines. But ordinary doctors cannot do this. Another thing, if you want to learn more about the homeopathic therapeutics on heart, please consult Dr. Samuel Lilienthal's Homeopathic Therapeutics. With this, the video ends. Thanks for listening and viewing. If you feel any difficulty, please write down in the comment section. I will certainly reply.